Welcome back to Inside Guelph. We're talking about postpartum depression after having the baby. And join us now, Dr. Elizabeth Sharavati. Thanks so much for being here. Lovely to have you.
Trish.
This is a topic, I think, I can only speak for myself for having had the babies, that when I was pregnant with my first, I was so nervous. I didn't know anything about it, but there was conversations about what, like having postpartum depression. What is it?
Well, postpartum depression is having symptoms of depression that appear in the first year after your baby is born. And that can feel like uncontrollable crying spells, feelings of hopelessness, anxiety, insomnia that goes well beyond, sleep disruption from having a baby, even thoughts of self-harm or of harming your child. And this can be so disturbing for women and so foreign to them often. And so it's very important that women understand what that looks like and that family members understand what this can look like and how to potentially prevent and certainly help women when they are encountering these kinds of symptoms.
Okay, so what are the risk factors going into it then?
Well, 3 of the most common risk factors are actually quite preventable. So a lack of social support or feelings of not being supported in this new transition into motherhood is a clear risk factor in the literature for postpartum depression. And so that can look like even not knowing how to ask for help and feeling like you have to do it perfectly. You're supposed to have instincts. It's supposed to feel easy. I'm not a good mother unless I know exactly what to do and feel good doing it. And that's just not reality, but it's not talked about enough.
No, and I told my cousin, I'm sorry I've said this on air before, but my cousin had a baby and I told her the worst thing you can do is go on Facebook for that first year because people post pictures of what they're doing, so you feel like you're not, she made cupcakes, I haven't made cupcakes. Like I was like, just don't go on Facebook.
Yes, it adds a lot of pressure, right?
There's pressure to be perfect.
That's right. Yeah. And then along with that, stress is a real factor for postpartum depression. And that can be marriage stress, it can be financial, it could be a life event like a grief or a loss that's happened. And that puts us more at risk of postpartum depression as well.
Okay, and the third?
Nutrition is a really big influence on our mental health, including in postpartum. And vitamin D is a very important nutrient, it's looking like in the literature for depression. So D for depression. We think of it often as an immune nutrient, but studies have shown, even 3 studies in the last year alone, have found that low vitamin D status is a predictive factor for postpartum depression.
Eek. Is that, how do you test that you have good vitamin D levels?
It's a simple blood test, so you can have that with your physician, your midwife, or your naturopathic doctor. And we want to optimize vitamin D levels and definitely avoid deficiency during pregnancy. Even deficiency mid-pregnancy has been found to predict postpartum depression at 3 and 6 months after the baby's born.
Oh wow! So that was my next question. You said within the first year, so it could rear its ugly head 6 months after.
Absolutely.
Okay, so you have to keep an eye out for those symptoms.
Yes.
You have a seminar for people. Do you want to give that information out?
Yes. So the seminar is called Naturopathic Care for the Journey from Tummy to Toddler. So we're looking at that. It's a real journey in wellness, from fertility and preconception care to having a healthy pregnancy, optimizing outcomes in the baby, and then caring for moms as they transition into motherhood when their babies are little.
Okay, what can we do once I like that I'm saying we. I'm not having any more babies, so I don't know why I'm saying we. There's no we here. But that women who have had the babies can then keep healthy in that year to make sure that they're optimal health and that they reduce their risk.
Yes, so I think if you're showing signs of depression or those feelings of anxiety or feeling out of control, is to talk to your healthcare provider right away, talk to a friend or your mother or someone that you feel comfortable with sharing, and get some resources in place. I also recommend making sure that you're screened properly for those preventable factors like the nutritional deficiencies, so deficiency of vitamin D, of iron, and a suboptimal thyroid function will also predispose to postpartum depression, and that's an underappreciated factor as well.
Oh, okay. What about, I know that your adrenal glands take a kicking when you're pregnant, and they can show the signs and symptoms of adrenal gland suffering can also feel like, am I postpartum, or how do we figure out where we're at? Like, what is the problem?
I think an individualized approach is really important. Thyroid and adrenals work together, and it's very common that our adrenals get depleted during pregnancy and certainly after, especially if you're trying to run the same kind of household that you were pre-baby.
No.
Because it's just not possible.
No.
So women, I encourage them to find ways to alleviate some of the pressures, alleviate some of the tasks that they would normally be responsible for, because the most important job is for them to take care of themselves so that they can take care of their baby. Right. Babies need moms to be well.
Yes, and sometimes the last thing you want to do is exercise, but what's the importance of that?
Yeah, so getting back gradually into exercise can be very important. It can help to rebuild your stamina, promote good sleep, and certainly is one of the treatments for depression.
Okay.
And so at the seminar we have Taylor Beach of Vitality Fitness, and he's going to be demonstrating some tricks that moms can do at home, even with little ones at home, to help them get back to feeling their best after they have their babies.
Oh yeah, he's so creative with his exercises, but he's the guy that in between cooking, he's like, just drop down and hold a plank. Whatever you can squish it in.
Yeah.
But it makes a difference, right? Yeah. In terms of your naturopathic doctor, what are you looking for to make sure that you're getting the right and the full workup? Post-baby.
So if you're having symptoms of depression or fatigue, then we want to make sure we look at iron levels. Women are so often told that their iron levels are okay when they're actually far below the level that would help them feel their best. So it's not just about knowing that we're not frankly anemic, but also optimizing that iron level so that you have enough oxygen in your cells to feel like you have some energy again. So iron levels can be quite a bit higher than you might be told on your wellness checkup.
Okay. Do people need to register for the seminar? Is it a walk-in situation?
RSVP is recommended because we have limited space. So they can call the clinic at 827-0040 just to reserve their space.
And last but not least, if you had postpartum depression for one baby, does that mean you're guaranteed to have them for every baby after?
It's definitely not a guarantee. But I would say it's a risk factor because previous history of having depression or another mental health concern is another risk factor for postpartum depression.
Okay. Thank you. Good information. Always good thoughts to take care of yourself first. The mama. Thank you. Lovely to have you. Taking a